Hi, my name is Ashton Bott, and this is the Case Study 2 presentation. The client that I chose for this assignment is a 5-year-old male that has an autism diagnosis. He was diagnosed in 2022 and began receiving in-center treatment 2 months after the diagnosis. When he first began ABA therapy, he used no mans and had high behavior frequency of biting and scratching. This behavior was eventually brought down by using ECT in order to gain his compliance and reduce his behaviors at the same time. The client has no other diagnoses known. The behavior targeted for this assignment was scratching. Scratching can be defined as any instance of the client attempting or succeeding to use their fingernails to apply any pressure on themselves or another person. An example of this is a transition was prompted and the client scratches the technician. A non-example of this is the client reaches for a toy and grazes the technician's arm. For this behavior, I decided to include that the behavior can occur on themselves or another person, as when we began the intervention, the scratching went from only technicians to being on technicians and himself. This behavior happens both at home and at ABA therapies. For the purpose of this, we chose to do operant extinction. A collection of ABC data was collected by the team, and the direct observation was occurred by the BCBA. For this, his team was 5 technicians, and the BCBA that he was under currently is a different one than when he began. So we had data that was taken by his previous BCBA and data that was taken by his current BCBA. It was evident that the client was being reinforced when being told, "nice hands," "not appropriate," or an expression of anger by technicians. Technicians will now ignore client behavior and withhold eye contact when the client is engaging in that behavior. The assessment we used was functional analysis. There was ABC data collected with his team of 5 technicians, including the case manager, as well as at home. At home, the parents filled out ABC data forms on paper, and we converted that ABC data to the computer afterwards. We collect this data for a 3-week period, and at home they collected it from the time that he got home to the time that he went to bed. There was also the interview with the previous BCBA, current BCBA, and ABA technicians. This behavior served as a socially mediated behavior. This scratching was socially mediated, being that he did this, or the hypothesis was that he was engaging in this behavior to gain attention from the staff. Originally, we had concluded this due to the fact that if attention was provided, he continued to do the behavior, and when it was ignored, the behavior still continued at times. This behavior was often paired with other behaviors, such as tantrums lasting anywhere from 1 minute to 30 minutes. These tantrums included scratching and biting both. Often it was hard to ignore both behaviors, as the biting and scratching were causing technicians to bleed. However, once this intervention was put in place, we had also went through the precautions of buying arm guards and ankle guards for the technicians. This allowed for follow-through on ignoring that behavior. Originally, the function of behavior hypothesized to be attention, but showed through the data to be maintained mainly by escape as well. For this, we also used alternative behaviors, such as also known as DRA. Those alternative conditioned behaviors that were reinforced. So some of those included using a calm body normally would receive social praise or attention from an adult. We did this intermittently and did this when he was engaging in any task with calm behavior when he was walking and following through with transition with a calm body. We also did this in instances when he had stopped using the behavior. We would say phrases like, "I love how you have a calm body right now," etc. We also started prompting or reinforcing anything when he was using communication to request any sensory input. This really helped because sometimes the scratching was due to a lack of sensory input. We also saw decreases with the sensory input implemented regularly throughout a schedule. Rather than prompting it to use those safe hands, we decided that the adult would use planned ignoring until the client stopped scratching in order to decrease the frequency of scratches and any attention provided, and then follow through with that demand to not allow for any escape from any of the tasks that were placed.